A recent UW-Milwaukee graduate created a program to help support LGBTQ youth mentally and emotionally, and it launched statewide in the middle of the pandemic. I talked with her and a member of her team about their effort to change lives.
People really need community and support more than ever, and I feel it should be as easy as possible to get that.
Before Erica Steib graduated from UWM's Zilber School of Public Health, she created a program that is now in use throughout the state with Mental Health America of Wisconsin. It's called PRISM, Peer Recovery in Support of Mutuality.
A safe space to explore concepts around identity, explore concepts around mental health diagnoses.
Steib is leading a team of 7 certified peer support specialists, including Jay Zelke. They monitor a phone line and email account and respond within hours to provide support to anyone who reaches out. Through text messaging, phone calls, virtual and in-person meetups, the peer support specialist helps that person navigate challenges and goals, and more importantly, is someone to talk to about anything.
It is so important to have someone who gets it. You can be authentically you. What's it like coming out to your family? What's it like coming out at a job? What's it like coming out with friends and things like that?
It's a job that hits home for Jay, who's studying social work at UWM.
So I came out as trans about 2 years ago. Throughout growing up in high school especially, it would have been really nice to have someone I could go to. So often I was just isolating myself and being I don't want to talk to anybody about it. No one gets it. The peer support specialists do get it. We are here and we will help you along this journey. Sit with you, listen to you, whatever you need, we're going to be there to support you through it.
That support has never been more critical, according to the Trevor Project 2021 National Survey on LGBTQ youth mental health, which found 42% of LGBTQ youth between the ages of 13 and 24 seriously considered attempting suicide in the past year. 70% say their mental health was poor most of the time or always during the pandemic.
Being isolated with the people you're living with, being isolated with those guardians, if they don't know you're out, then you're almost forced to have to stay this person that you're not. It makes those feelings of being alone even stronger.
48% of the LGBTQ youth surveyed wanted counseling, but were unable to receive it.
A lot of the LGBTQ population in general either lack insurance to access mental health care, or they've experienced so much discrimination and stigma in that setting.
While PRISM was created specifically for 16 to 26-year-olds, Steib has been surprised at how many older LGBTQ adults are reaching out.
Who live in more suburban areas. They're also, looking for community and looking to make sense of their identities and stuff.
She says this corresponds to a shortage of LGBTQ-specific therapists and counselors, who she says can often provide more targeted and supportive care around sexual and gender identity.
Where the mental health conversation needs to go next is around addressing things like homophobia, transphobia, racism, sexism, because these things do impact mental health, and that's where I think people are starting to find the language to describe that and understand how much it impacts them.
To talk to one of those peer support specialists, call 414-336-7979 anytime, or email prism@mhawisconsin.org, or send a direct message to the PRISM program on Facebook or Instagram. They are doing great work.